I called you. You called me. I'm trying to find out. I walked up to the light station. So good. Yeah. And then you can. My heart needs an EKG right now. I think I can. I'm actually signed up. Okay. Yeah. Hold on one second. Oh, because you're. I was just thinking. I was just like, oh, Aaron, what is she doing? I didn't actually look at your chart. I just like covered. I was like, oh, okay. I didn't even know. Well, probably nothing that you don't know. I'll go see. That's not what I said. I mean, we actually meant to be more. I feel like it's just like we shouldn't. I look at my sense they should. I looked at my own chart to show someone something, and you know how many times I was thinking that, but I wasn't gonna say it. Yeah. Oh, later. Yeah. So yeah. No. Just. And I went to watch it. Yeah. Well, I'm the best. I'm so. And then I went up to here, and over there, I'm working. Oh yeah. With Suga, and then. I was gonna ask you if you okay? Every Sunday. I'm fine. I'm so fine. But I had yeah, they are good. Good. Literally the best. No, this is just converted. No, I don't no, I would have gone. Yeah, it was so good. And but like, try to like this. Have you done it before? I've never been much of a big old and I did so well. It seems like it's so that's I know it's silly. But you know how we have to go isn't that way? And I'm really I love I should do this the night before and just send it to you. Let's take it. Oh, cool. Well, you can start your own class. No. Well, between that and AI, you don't really. Oh, Australia. That's the craziest. Yeah. But it's the craziest. The way we. Sorry, I don't understand. Oh wait, Siri. You want muscles up first? You know, or you want the other one? Let's do the other one first. It should, yeah, it's got all the items, and I've got kind of stuff. Yeah. 280 slides.
Yes, sometimes you just have to. I need to hear that now. Some of it is, I keep adding slides, and then some of them I redo, and I really need to pare that.
Yeah.
It's too many. I will do this. Be right back. Use the restroom.
Okay, no problem. You're ready when you
Answer my question. Yeah, sure.
possibly. I don't know if it works, but we'll find out.
I was like, it was really like not telling me. So great.
I got mine if you want it instead. And I got that other one if you want the other one instead.
Other clicker?
Yeah. Actual clicker. Yeah. Not the beat out.
I'm the same old girl. I'm just now, but you work so hard. Save for the emergency or something. Yeah.
Right.
Yeah. I'm getting sick now. I'd love to know. It'll come. I know. I just said the same thing.
This is not.
Wow.
No, this is missing a whole bunch of.
Leave it? Exactly.
I messed up.
Okay.
I messed up.
I start seeing patients.
That's right.
Oh, I'm sure you're doing a great job. Because I keep thinking, like, people are going to trust
Okay,
their
here's the.
Yeah, let me out. Yeah.
Section 5.
I'm honestly not.
This is the one. This is our PDF.
I'm still
Open that up.
Yeah.
And we've got
I guess.
everything.
I guess.
That's the one. That's the one. And, so I put it back in your thing.
You're watching. Oh yeah, they're always watching, listening. All right. I should go look at it. Did you look at it? No, you did. Oh. Oh, this is the one you haven't did?
So I put both of those.
He's trying his best. He's trying.
I don't know.
Yeah.
This one's called.
AK Session 5. Muscles and meditation. I went also put.
Oh, no, see,
Yeah. No, not that one. That one. That one.
Okay.
Those two should be.
but I think
Session 5.
Good, how are you? Good to see you. Elle, I have.
Can't believe it's been so long.
I know.
Amazing.
Amazing,
Anyway, I'll get that all together. We were on we were on, yeah, we were very functional. It's just oh, makes sense. Sorry. No. Oh.
So, good afternoon.
Just looking around.
I think we start. I'll start and hope the slides catch up here. Looks like we got. So it's been a long time since I've been here. It feels like more than just 2 months. But you guys had finals last month, and so hopefully this works out for everybody doing, skipping March and going into June. June, you're out of school, right? You're not. Okay. So, welcome to session 5. Before I get started, I talked to Aaron a little bit. We were talking last night a little bit. And I sent out an email. I don't know if any of you saw it or read it, but I sent out an email kind of letting you know that I want to start kind of like doing more review so you can get an idea of what to expect with the test. How many of you are planning to take the test, the certification? 7, 8, 9. Everybody is. I mean,
She's not.
you've already taken it.
She graduated. She's got all the stuff.
And you have your certificate and everything, right? But did you get one from the year before? I'll get you. Yes. Do not let me. Yeah. Because I got to get one for Shy too. I've been in touch with him lately. He's out of school now.
Oh, is he?
Browns in Scottsdale.
I love that guy.
Yeah. So everybody's going to take it. That's good. So there's some of you that aren't here that may want to take it. If you have the hours, okay, another thing, make sure you have your hours sheets. If you don't, we'll get you a new one and we can fill in. But make sure you have your hours sheet because I don't have to submit those to the ICAK, but if they decide that too many people are passing the test, maybe they might want to audit me or something. So I need to have those. And you're supposed to be in attendance. Or if you've seen it if you've watched any of the sessions on video, I need to know that too, because I can give some extra that, but you have to watch it. So you can take the test if you've been to half of these live, but have watched the other ones on video, which I assume are available. Have any of you watched them on video? Oh, you have. Okay. Are they hard to watch?
I watched it on 2 times speed.
Oh, okay.
There's a lot of like dead space in between and
So they need editing. So they need to be edited.
Are you not edited
No.
on your side? Because I have been.
You haven't?
Yeah.
I mean, the one that I watched was like the second. It was very early on, and it was fine.
Are they?
Like it wasn't like dead space. I didn't know. Like roles in the past and everything.
Got it. Okay.
So anyway, so if you see them, if you watch them, you get credit for that. If you don't watch them and you've only been half the classes, probably you don't have enough hours to really, which is fine. I mean, but you really should have all 100 hours to be eligible for the exam. The exam's 100 question, multiple choice. There's some matching and multiple choice. I got 3 different exams that are pretty similar, but most of them are multiple choice. Then the practical exam is, I want to do it session 6. We could do it maybe on Sunday of session 6. Practical exam, and we can go through a sample of what it's like with the practical exam. Basically, you come in pairs. I have the doctor, we do doctor and switch. I ask you to do something like, for example, evaluate category 2? How would you plot for category 2? I'll ask you at least 2 or 3 muscles. You have to show me how to test them. Show me how you would test them. And then I might ask you a question or 2 about the muscle in relationship to mainly. So mainly know the muscles, know the muscle tests, know the Chapman reflexes, especially know the, you're going to learn, this session, we're going to start learning alarm points. Which I'm excited. One of my favorite parts to teach. You need to know the muscle organ relationship. You need to know the muscle meridian relationship. You need to know the basic muscles, how they affect posture. What to look for on posture exam, or potentially a gait exam, mainly static posture. You need to understand the categories 1, 2, and 3. We've all covered by now. You're going to need to know a few things about cervical disc. And cervical disc, we covered that last session, didn't we? We did. It's going to feather into the shoulder stuff this session. Yeah, you need to. Yeah, as I think, I'll try to make a point of saying, okay, this is definitely on your test, or this might be on your test, or this, don't worry, this won't be on your test. I'll try to qualify that as we go. And please feel free to ask, is that going to be on the test? And if I remember for sure if it is or not. Yes?
Do you have any sort of like
I mean, other than your notes, going back, and of course, Walter is great because if something's unclear in the notes or the slides, you can go to Walter areas, which usually seems to be a problem. Yeah, Walter, have access to Walter. Yeah. Study guide, I'll tell you what there is. I'll do a plug for my good friend back in Florida. His name just escaped me. But he has put together a set of flashcards for studying anything, and they're very good. I've seen them really good, and I can't remember what he charges for them, but you can buy those through the ICAK website. Just go into products and Jay Marinville, Dr. Jay Marinville, he's a great guy. He also teaches the 100-hour course, and he's just a really top flight guy. And he's put together these flashcards, and they're very good. They're way more than you'll need to know for the 100 course. But he covers everything. I thought about buying them just so I could use it for you. I hopefully often getting this stuff. Anyway, so the test is a great way, even if you don't think you're prepared, take it anyway. It doesn't cost you anything, and you'll find out really where you're at as far as stuff. And then you can take the test as many times as you want. I had one student here a few years back when I was teaching in Seattle. He took it 3 times and finally passed his year. And I really, the first time he just failed it miserably. The second time, not so bad. And the third time, he actually did pretty well. Anyway, here we are. These are session 1 and 2 muscles. We're going to always be going back to these and trying to review these. Session 3 muscles. You guys these all look familiar, I hope. Session 4 muscles. We got really into the foot and ankle last session. Did you guys get a chance to do any work with your friends, family, clinical patients? Yeah. Feet? Yeah. Quite weak ones.
Yes, found weak ones, found bones that were out, everything. We
You'll
did
find
adjustments,
if
we
you
did all
look for
kinds of stuff.
these, we were talking, Jennifer and I were talking about tip posterior is something that I find all the time, and it's super important to fix it if it's messed up. And nobody checks for it. I mean, it's often the missing piece of the puzzle with pain, finding it's easily injured, doesn't, it sits between the back of the shin and the calf muscle. It's constantly, it's very easily get ischemic in its own compartment. I work on tip posteriors at least every other day. Anyway, these are the new muscles. We're going to be talking about the shoulder a lot, so I do have rhomboid. We've done rhomboid, right? Okay, we're going to reintroduce rhomboid and then levator scapula, which is kind of above the rhomboid. Anyway, these are all the rotator cuff muscles, and these are other. So we're going to learn by the end of this weekend. My goal is that all of you guys are experts, or you're going to know how to test every single muscle that affects the shoulder. You're going to know how to determine, what's really going on with it. Most of I get shoulders coming in all the time, and they, because I can't see people that quick. They've usually been to an orthopedist, physical therapist, acupuncturist. They've been around the horn, and sometimes I can't fix it either. But very often I find something that no one else has looked for. So shoulder conditions, these are all things you're going to see a ton of. These, tendinitises and bursitis, they're really, really common. AC capsulitis is a particularly nasty problem that you don't want to. If we catch these early, we can fix them. I fixed many that would have turned into, and I've reversed a lot of them, but I've had some that just didn't fool out of me. There's this epidemic of adhesive capsulitis, frozen shoulder that gets that bad in middle-aged women for some strange reason. You see it in women probably 4 or 5 to 1. I see it in men too, but in fact, I just had 2 in men this last week. But anyway, so do you guys remember we talked about shearing and compaction injuries? 2 main kinds of injuries. Do you remember shearing injuries are your classic sprain? There's usually going to be a primary muscle that's injured most often, and that muscle is going to respond. It's going to be weak in the clear, maybe painful. It's going to usually respond to spindle up, TTO, and/or ONI. Then there's going to be an antagonist to that muscle that's going to need fascial flushing, or what I tend to use PNF stretching. It's going to be the tight antagonist to the weakness. So it's all, like, remember all that. And then the third component of the triad, we call the triad of sprain strain. Third component is going to be a synergist, and sometimes more than one synergist, that is its spindle cell set point becomes off because it's trying to compensate for it. So it will be strong in the clear, but then it'll test weak after you have it put in a full contracted position for about 4 or 5 seconds. Let it relax and then retest it again. That's what we call it. That muscle needs strain counter strain, or what we call fold and hold. Remember that all. So that can be applied to any joint in the body, shoulder, hip. There's going to be, when there's a strain, shearing kind of injury. The other category of injuries that we talk about is compaction. That's your classic where you fall and you jam a shoulder. And that's, instead of a strain like this, it's a jam. And you see it in the hip a lot, you see it in the ankle a lot, you see it in the talus all the time. You see it in the shoulder, wrists, joints that are prone to getting jammed. And you see it in the spine too. Call it set imbrication in the spine. Compaction injury, all of the muscles around the joint are going to be weak, except for usually one. And that muscle is going to respond to rapid muscle activation. That's where it's strong in the clear, but then you have them do 8 or 10 contractions, and that muscle will need to be treated with O&I, origin insertion. And then if there's a compaction injury, you have to find a way to manipulate the joint so that you're unstable. That's where it works. Either respiratory or dynamic. Talk about trigger points. Bilateral trigger points a little bit, I think. So basically, when a muscle is weak, just going back to session, when a muscle is weak for 2 categories of reasons, one of 2 categories of reasons, sometimes both. One category is something wrong with the muscle itself. It's had a shearing injury, compaction, local compaction injury. There's trigger points in it. The muscle itself is compromised. Tendon sheath is inflamed. The attachment is irritated and inflamed. The muscle spindle, there's a trigger point sitting right in the midst of the muscles. That's a local muscle problem, and that needs local muscle treatment. Spindle, fascial flush, O&I, GTO. Then the other category, of course, is everything else. The nerve supply to the muscle, the lymphatic drainage, i.e. Chapman reflex, lymphatic drainage of the muscle, the arterial blood supply to the muscle, which we'll call Bennett reflexes, the meridian, that muscle is on the wireless system in the body, and then of course the cranial sacral. Cranial sacral can throw off all kinds of things, remote to where the actual cranial sacral is functioning. So, anyway, shoulder, and we're going to introduce acupuncture, and that's actually the first thing. I've got 3 things on acupuncture this session and the next 2. The first one we're going to do what we call an 85%. And that means this protocol that we'll use works about 85% of the time. And we've got a 10%er and then we got a 5%. That's where you have to get creative with using like the Shen and co-cycle and some of those things. But the first approach is pretty straightforward. We are going to learn, I've got a bunch of slides in here on the meridians. Now, any of you also acupuncturists? Whether, yeah, as part of your curriculum. Okay, so you have all of you had acupuncture training so far? Pretty much. You have it. Okay. So some of you may know more than I do about acupuncture. That's very common. I know just enough to be dangerous. I use it all the time. I find it so helpful in my practice. And I don't do needles. In Oregon, I'm not allowed to use needles. The acupuncturists in Oregon have been very effective at keeping us from getting that as part of our scope. They're small but potent lobby group. Bastards, you know. I keep trying, but it's like they keep shutting us down. You know, in Washington, friggin' physical therapists can use needles. You know, chiropractors, and in Idaho, chiropractors can use needles without any extra training. But in Oregon, anyway. But we can deliver babies in Oregon, so not that we do, but we can. Because in the olden days, actually chiropractors out in small rural areas, they did all kinds of minor surgery. We were trained, none of which they just do now because you can't get malpractice. So here we go. Anyway, so I'm going to go through, and this is the AK perspective. We gleaned from acupuncturists and created some AK protocols. There's a lot. I understand there's a great deal more to acupuncture in therapy than what we're doing here. But this is a very quick way to access that system using those tools. And we can access it wrong, and we can also use it to treat. And a lot of times where we find a subluxation or fixation, it's also disruptive to meridians. So you can fix, you could be access, with one adjustment, a lot of times you're accessing the meridian system, nervous system. So anyway, this is stuff you guys already know, been around forever. I'm not sure when, this is not my slide, so I didn't research this, but 5,000 years? I don't know. Wasn't there some treaties that was written, I think, at some point in China? That was where that really marks the birth of acupuncture. And there was all kinds of different things being done for centuries and centuries, and then one particular, it seemed like it was part of one of the dynasties or something, compiled it all. Kind of like what happened with yoga. There was all these different things being practiced, and then at one point he was a monk of some kind, wrote the Yoga Sutras, and that's kind of what it's been based on ever since. So we're going to use acupuncture in a couple ways, basically to redistribute qi in general, but also you can use it to block. Anyway, this is, guys all know this, but there's been a narrative and a model of non-physical or non-tangible, physically tangible energy since the beginning of time. One of my favorites is the Elan Vital. I remember in undergrad I had to write a paper on something, I can't remember what it was, and I learned about this. I think it was a popular term in Europe at one time, the Elan Vital. I'd like to say it because it made me sound like it. But that's, in chiropractic, they call it innate intelligence. But what is it? I mean, we know that there's energy fields. We're basically a cloud of energy with like a physical body kind of inside of this cloud of energy. But there's direction, there's precise direction to this energy. There's specific pathways, specific directions that it moves. And when I do energetic testing with patients, I have to explain them. I say, the same intelligence that's in your nervous system, in your cells, in your DNA, that same intelligence comes clear out into your aura. That's why we can use these substances. Now, I'm not even sure if that's true, but I do know that it works, and I do it all the time. I'm not exactly sure if that's 100%, but it's a quick and easy way to get them. At least they know. But now, are any of you doing energetic testing? I know. Meaning that if you test a substance, you're not actually having a patient ingest the vitamin. Ingest them.
I've tried it.
Tried it, yeah.
Like
So
sad.
I think we touched on this maybe in session 1 or 2, but officially, and this will be on your test, they might ask you a question, they'll probably ask you a question or two about nutrition testing. Now, if they say something about, well, you can test nutrition by laying it on the blood, true or false? Answer false, if you want to get the question right. Because in official ICAK policy is that we only test using direct access to the nervous system, i.e. we're triggering receptors, taste receptors and smell receptors. So if you have, say, deltoid, you've done all your stuff, but you're thinking maybe there's some lung meridian shows up as being somehow efficient, you can, at some point before you fix everything, you can go in and test vitamin C or any number of things that might be helpful to the lung as an organ. Technically, you're supposed to have the patient taste the vitamin C. That way, you're accessing correct neurological receptors that pick chemoreceptors that pick C. Now, there's been various studies where they've shown that it isn't that different. That there's a problem with having, it's getting a little off in the weeds, but I want to do something. There's a good argument for using direct neurological receptors. The problem is once someone takes that vitamin, it's now in the system, or especially in homeopathy. If you give someone homeopathy, treat it. So it's not like you can't like go back and say, continue your test. So it makes it really inconvenient when you have to access these things. So people like Dr. Lieberwitz and Dr. Wally Schmidt, they over the years have come up with, I think, some pretty good ways of energetic testing. And the way I use Lieberwitz work, it's the only way I'm comfortable with it. I double-blind test everything. So I have a whole bunch of vials that all look the same, and without my reading glasses on, I can't read what's on there. And I know what's in the kit, and I just start testing 2 or 3 days. Patient doesn't know what I'm testing, and I don't know. Every vial gets tested 3 times in weeks. So if it's positive, it'll be positive 3 times. Then I go, and I'm comfortable with that. If I have several different kits that I've made up, and I have duplicates. Like I have 2 lactose vials, got 2 solanine vials. These food proteins I test a lot. That way, if they better test on both of them. If I go through and I find out that one lactose tested and one didn't, then I don't go with that. It's just not good. But if there's 2 in there, I do it to kind of just to challenge this system I'm using. And if they both test, then I'm good. So that's the way I test. It's not official ICAK policy. The official ICAK policy is test on the tongue or sniff test where you're accessing olfactory receptors. Anyway, we're going to be doing we're also covering thyroid this weekend. Got some really cool things that we can test. Anybody have thyroid problems besides me? I've got a weak, small case of. Yeah, I've mild Hashimoto's years ago. I've never taken medication, but I've had to manage it with nutrition and diet. So I have a lot of patients with thyroid, but it's a tricky thing. You'll see a ton of thyroid in your practices, and they're not easy. Most of them are not. So anyway, 12 primary meridians. You guys all know this. The meridians are paired, a yin and a yang. What's interesting is the yang meridians flow down, and the yin meridians flow up. The yin meridians all begin or end on the chest. The yang meridians begin or end on the feet. And we will use those beginning and ending points. Dr. Wally Schmidt used to use those for all kinds of things on the face. EFT, familiar with the tapping thing, all that. They use B&E points as well as like the master, 7 and 21 in those. Any of you familiar with EFT? Anybody not familiar with EFT? I don't do EFT, but it seemed to be all the rage a few years ago. The meridians all flow. These two books, I know you're familiar with this one. This one was actually recommended by Rachel to me, which I think is a really good one. This one is a really nice manual I found online, I don't know, some years ago. They're both good. I really like both of these manuals if you don't already have them. They're both online. I mean, they're both downloadable. So Qi, another thing I try to explain to patients, because they're always asking me about acupuncture. Oh, should I try acupuncture? What do you think about acupuncture? Think that does any good? Well, but where is the Qi? Where is this Qi? Where is it moving? And there aren't anatomical acupuncture. There's no channel like there is for lymph or blood or nerve. It's an energetic zone. But there was a German scientist years ago. He's long dead. He was doing experiments. He had determined that the Qi moved through the myofascial matrix. Myofascial matrix was literally where the actual photons of the movement. So if the myofascial matrix gets torqued and twisted and blocked up, it's going to block. And if it gets too much fluid, Qi, if it doesn't have enough fluid, it's going to not be able to transmit Qi. So for years, it kind of puzzled me that we have this energetic body and this matrix of energetic information moving around, yet where is the interface with the actual anatomical body? And that is the best explanation I've gotten so far. So, and his name is Pichler, I think his name. One of our ICAKA German colleagues, Hans Garten, who's just a fantastic guy. He's maybe it's somewhere over there. He turned me on years ago. We were talking about this very thing. He said, "Oh, have you read Pichler?" So he sent me some stuff that was translated to read, and that's so. Anyway, so the energy is everything that goes on has in existence has an energetic. Ultimately, it's just clouds of electrons moving. In fact, electrons may not even be a thing, right? No one's ever seen one. They're just like a potential. So I explained to Paige, another thing I say, well, look, we have our hardwired system of moving information around the body, how the body communicates with itself. Then we have this wireless Bluetooth system that is sort of overlaid and intertwined with, and that's our system. And that seems to satisfy them. Hopefully that's true. But say what the meridians use photons and your nerves use electrons, just like the wiring in your house or your car. So anyway, if you have any insights on that, you learned about acupuncture, has stumbled on any brilliant narratives around where the energetic and the physical interface?
There's something that I learned in a thing called Dr. Tan. I don't know if you've heard of it. So
TAN.
TAN, Dr. Tan. So it's really interesting where you pretty much find the pain, where the pain is. And there's specific meridians that associate to where the pain is, but you find the meridian that the pain is in, find the associated meridian, and you palpate along that meridian and find the most tender point. And usually you only use one needle. And it normally, if someone, I've done this on a patient, if they come in with 5 out of 10 pain, it usually reduces to 2 out of 10 by the time they leave, which is really cool. Yeah.
You're treating the meridian that the pain is on.
The opposite meridian that the pain.
The opposite meridian. So opposite.
So let's say they have
on or they.
kind of. So there's a specific chart that they use for it. Let's say that you have medial knee pain. I think the chart points to liver, gallbladder. And that relates to like the lung gradient. So that relates to the lung gradient. So patient that I have seen, we palpated along the lung gradient, especially around her elbow, and found like the jump trigger point. Yeah, opposite. The opposite.
So opposite hand,
Uh-huh.
different meridian?
Yeah.
So the
Different
meridian, it
meridian.
sounds like the meridian
But they're
upstream
connected.
from, yeah, because the liver flows into lung in the large intestine and on it. So, interesting, huh?
Yeah.
Cool.
So we only have to needle like one point usually for them to.
Well, that's similar to what we, in AK, what we're gonna learn here, where we're gonna use the tonification point to reduce pain. So that's really neat. Dr. Tan,
Dr. Tan.
is he from here?
I don't know. I've learned this.
All right, yeah, I mean, anyway, this slide was in here. National College of Chiropractic some years ago did, they found that they could, that there was meridian flows in cadavers. And I'm not sure how to do the study. I'm not sure, any of that, but that was something that now, you wouldn't think a cadaver would have chi. But maybe they were able to transmit a current. I don't know. But anyway, that slide's in there. So acupuncture, I don't use acupuncture. I don't use needles, but I use meridian therapy all the time. I tap it. I use a laser. I think I brought my little laser. A lot of times a lot of times the tonification or the low point or whatever I'm going to treat is right next to something that needs to be adjusted. So a lot of times in the feet, you adjust the feet and you cleared a lot of meridian blockage that way. So anyway, the Twina, which I don't really, I know that it's similar to what we do with chiropractic, but you're basically, the way we approach it in AK is we're basically using the bladder associated points as they correspond to the spine. And in our protocol, we'll learn in a little bit. We always go, after we treat the tonification or low point or whichever point we determine we need to treat, then we go to the spine, to the associated level on the bladder meridian, and we look for a subluxation. And you guys remember from one session back, we talked about the love-it relationship. Love it, brother. So if you find a subluxation at one level, you look at the love-it, which is going to be the other corresponding, because they start at C1, L5, and together like that. So if you C5, find a subluxation at C5, then you check the one at L. And that's what we'll do to finish our meridian protocol. Now you can therapy localize acupuncture points. You can therapy localize the points, which we're using to diagnose with. The patient can TL. It seems to also work, and in an AK where another thing that might be on your test, talking about how whether you use doctor TL or patient TL. Talked about that a lot, right? Typically, patient TL is considered the best, most accurate, the most valid way of therapy localized. Sometimes, of course, that's not convenient, and especially in the spine. And a lot of times, if you can't get a good therapy localization, say when you're testing around the spine, the doctor can go just directly in and challenge. You skip from TL to challenge. That's one way. But with acupuncture points, and I do this a lot just to save time, I will actually touch the pulse points when testing the patient instead of having them. I'll show you how to do it. We'll do it the really most accurate way, and I'll show you a little shortcut as we go. Anyway, so I know when you train to be an acupuncturist, you learn how to read the pulse points, which to me is just amazing. I can't really maybe. But you can therapy localize, and you can find shows the need for attention. If you have good muscle testing skills, you don't have the need. Any of you good with pulses? Good with pulses? Sorry. So my son-in-law's parents. Hope they're okay. Anyway, so there's 14 meridians, 12 paired, and of course conception and governing vessel are unpaired. The chi flows. This is kind of a funky slide, but the chi flows in this direction, and about every 2 hours, there's a meridian that is the most energetic for about 2 hours at a time. And that's what we get into like the 24-hour clock and low points. A lot of times the energy is stuck, say it's stuck in the gallbladder, and so the liver downstream, the meridian starts to show deficiency. And so you have to go back to the low point. You have to go to the liver low point to open the gate to let that chi move in. So that's 15%. That we'll learn next session. So you guys know all this. Light, dark, male, female, the yin and yang thing. The interesting thing is the yin organs are all solid organs and they work all the time, like the liver. The yang organs, which are more associated with the male energy, are hollow organs and they just work down there. So it's like, you think of a pride of lions. The male lions, mainly, they don't do a whole lot. They breed and they lay around to kind of protect the pride. The female lions, they pretty much do all the work, including a lot of the hunting. Anyway, that's one way to remember it. Kind of, sort of. These conditions that they'll have these qualities, the yin qualities, or I'm standing in front of you. The yin qualities and the yang qualities. Of course, this goes into emotions too. There's emotions will affect the meridian system first before it eventually affects the endocrine system and the vascular system and the emotions that affects physiologically. So mostly we'll be using tonification points. I use sedation points actually fairly often. I'll talk about that later, but I use mainly tonification points and I use them all day long. And then, there's certain ones that seem to always show up on people. The liver meridian always seems to be, and you have to kind of start there, and then I also find a lot of problems with fire element, heart, small intestine. Small intestine, triple worm. What's the fourth one? There's 4 fire elements: small intestine, heart, circulation, sex, and triple worm. Thank you. So if you stimulate a point, you stimulate the meridian. If you keep stimulating it, it will actually start to sedate the chi in that meridian. And that's one way to get a pain. Short term, but similar to what you're talking about. Also, this ties in to our pain management mechanisms in our with regards to our nervous system. We're going to talk about IRT this weekend. I introduced IRT. I haven't. Did I? I didn't. In the 4th session thing we did. So most of you probably know this. Pain is carried on relatively smaller, slower nerves. Proprioception, touch, vibration, A lot of these other sensations are carried on large, vast nerves. So if you are, that's why if we bang our elbow or something, we rub it. And that rubbing stimulates big, loud skin receptors, which drown out the pain. Unless we really crunched it, and then the pain will still be. But that's how, that's one of the reasons massage, pressure point stuff, movement. A lot of times we go to the gym and we're kind of stiff, and after we start working out, our pain just kind of vanishes, except for maybe places that were really hurt. But anyway, so endorphin release comes from this stimulation thing, just like we get from adjustments, acupuncture, all these different things can cause the calibration of how we experience pain to change physiologically. You guys know this, right? That we measure 1 sun, 3 sun. This is the sort of the 5-element thing. We will, session 7, we'll talk about how we can access through the Shennecoe cycle. So now Dr. Goodhart, before you guys go, wait a minute, Dr. Goodhart came up with these 4 pulse point. He said that they relate to the conception vessel and governing vessel. I use those sometimes. I mainly use the 3. It's like, but that's Dr. Goodhart seemed to think that was a thing, and it will work. You can a lot of times tune into whether it's one of the midline meridians or here's some other. You guys know all this, the different elements, different qualities. There's different emotions too. I don't think that's on this chart, but liver, gallbladder, you're thinking anger and resentment. Grief is metal. Some of you studied NET. Anyway, this goes on and on and on. So these are the meridians. These are the yin meridians and these are yang meridians. Pulse points we're going to use to diagnose. You can, I'm going to bring somebody up here in a second. Usually, somebody who's feeling a good night's sleep. Oh, let's see, we'll find out. Do you mind head this way? Head this way, just the opposite. So let's do this here. So here's how we do it. And you can do this seated or a number of ways. But I try to use a indicator muscle that's the lower extremity. So what am I testing? Just checking. What am I testing?
Where are you going? I didn't see. Sorry. TFL.
TFL. Thank you. What am I testing? Who need? What am I testing? That's the cheat test. This is the cheat test, the really good test for adductors and abductors versus sideline. So we got a good rectus femoris here. Push, push. So I'm going to take her 3 fingers, place them on the pulse points. They're about a finger's width apart. Now, this is gonna be kidney, bladder, liver, gallbladder, and small intestine, heart, right? And I don't know if I'm not specifically testing, I'm testing the two together. So something in that six is causing the leak. Now, for the other side, usually only one reading will show at a time. Okay. Now go ahead and breathe in again. She hold the breath. Breathe out. I'll make sure I'm not missing something. Hold the breath out. No, we're good. Okay, what am I screaming for? Okay, so over here, now we take, Dr. Francis always, he was great with these goofy old man jokes. He goes, now, give me a finger, not the finger, but a finger. So, of course, we all laugh. So we can start with heart, small intestine, just medium pressure there. Whew. Okay, something there, let's go. Now, if I find more than one pulse point, and occasionally I do, I then stop and I look at the wrist, I evaluate the wrist. That's good. And a lot of times the wrist is jammed, or maybe there's some tendonitis. There's something going on there, and they're TLing that injury. So let's go back. Now, there's two ways to approach this. One way to determine whether it's the yin or yang. One way is just have the TL, okay, that's small intestine part. I'll test the heart muscle, and I'll test the small intestine muscle. I'm already testing the small intestine. The other way, and I don't feel like this is that reliable, you can have them touch very lightly, which is the more superficial, and have them touch a little deeper, which of course would be the heart. And that works on you. But a lot of times, that I don't find that to be, especially with regular, people like you guys are much more tuned in, but your regular person in the wild. So I would go with, now that small intestine, however, we're testing a small intestine. I hope you're not one of these 15%ers, you'll have to do something else. So that's fine, but we have other small intestine muscles, right? Can somebody tell me? Another one? Anyone? Let's do in rectus. Oh, rectus, yeah, thank you, rectus more, yeah. Push, hands off the body. Push. Yeah, see, there's a weak quad, just small intestine. So, the rectus, femoris, is good, but the right rectus, the right quads as a group, not so much. So, then we go to our alarm points. We'll stop for a second there, and let's see, I should have those up here. There we go. And then we go to our alarm points. These are, some of them are bilateral and some are just on the conception vessel. Small intestine is right here. It's about 2 cm below the belly button. These are really common. There are these 3 at the bottom. It's like 3 small bladders. That's how Dr. Francis should say that. That's how you remember it. Triple warmer, small intestine, bladder. And and these top 2, triple warmer, small, they're both fire elements. So I'm going to have you take. I usually have the patient, once again, 2 fingers instead of 1, because that way you close it. So there's 3 small right there. So, and I see it turns that muscle on. Now, we're getting lucky here. This is working exactly the way I push up. Okay, so that means that muscle, that means that meridian needs it. Now, if I go to this other quad, which was fine, it weakens. If I go to this muscle, which I was using, it weakens. If I go to this TFL, it weakens. She globally weakens now to the therapy localizing that alarm point. That just double, triple verifies that's the meridian we need. So what do we do next? Well, we tested the muscle, we found that it was associated with that alarm point and it turned on. Now we have, now the next thing to do would be to probably treat, would be to test it for nutrition, which we would use a tonification point. Small intestine tonification point is, I have all these on here so we can access them. I'll go back to the, there we go. So small intestine tonification, the ones in dark, all right, small intestine 3, right there. Now I can be really thorough. I can have you touch that point. I don't do this every time, but I might do it to make sure, see that point therapy localizes. So that's my treatment. And we could go just a little bit further up meridian. And nothing. So that just tells me that's where I'm going to treat. And then the associated, sorry I didn't have these slides, the associated points, because that's a small intestine tonification. Right, because that's the small intestine 8. That's the low point. And since it's strengthened to its own alarm point, I don't need to use it. That's a good question. I'm going to go back to my. Okay, so if we look here, we go all the way down small intestine, the point on the bladder meridian, the associated point that we're going to look at to see if there's subluxation, is at S1. So basically a sacral, there's some kind of sacral issue. So remember how we find sacral problems? The eyes, ocular lock. We screen for upper cervical and sacral. There's another way we could do neck extensors. But why don't we just go here and stay with chin. Now roll your eyes straight up. Roll your eyes up to the right. Straight up and then look straight down. Look straight down. That's sacrum. Usually, that's usually base anterior, but now down and to the left. And to the right. Not sacrum on the right. So it's sacrum, but sacrum on the right. How would I verify that? Name one way. There's several ways. How would I name one?
TI.
TI. Yeah. If I go back to the strong indicator muscle. I could. Yeah. So there could be a bunch of other stuff there. I might want to also check L5. I may want to check her ICV. There's all kinds of things I might do junction, but that's pretty straightforward. So we need to stimulate small intestine 3, and we need to challenge and adjust. We pretty much determine that it's the right sacrum. We need to challenge and adjust. So we'll go back and retest. So when you find when there's something like small intestine 3, which is right next to this joint, I'm going to look for a problem with the joint. There's something that feels okay. Check her wrist. Yeah, those are. So I'm just going to go in there and, oh, I know what I could do. I think I brought it.
Sacral on the right could also be a category 2.
Could be. I mean, there could be. We could test her for a category 2.
Or am I just confusing the like overlapping?
No. I mean, when there's a problem with the sacrum, there could be a problem with its relationship to the innominate. But it could be the problem with the sacrum could be that its disrelationship could be with L5 above. So whatever it attaches to, that's how, when you think about adjusting, you gotta think about, what structure, what's there, what can go wrong. There's this, when I was in chiropractic college, I can't remember what class it was, but the professor brought a local MD in to talk. He'd been in practice for years. He was an MD that liked chiropractors, so he was kind of a rare bird. But he said that when you anything you approach, he said, what you have to do is think, okay, what's there, and what can go wrong. And you know your anatomy, you know your physiology, and you know what can go haywire. He said, this seems so simple when he said that. And that stuck with me all these years. So I'm just using a laser. It was a 4 something, I can't remember, hertz or whatever it is. Let's go back to, I want to use this muscle here. I'm using a different indicator muscle. So I'm going to go in here and I'm just going to bounce her sacral base on the right, because that's where her eye is pointed to. Bounce, 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 hold. She goes deep. Now what could I do next? Bounce, bounce, bounce. Take a breath in. Hold the breath, bounce, bounce, bounce. Negated by a breath in. So I could do a respiratory correction on her quite easily, which I'll do. So I'm just, to do a sacral adjustment, respiratory, I just hold pressure there. If you're a really big, heavy person, you can, you can put like a, some kind of a, you can take a wedge, like a SOT wedge, and wedge it in there. Now I'm just going to bring it up this way. I'm having to breathe in. I'm using her thigh as a lever, and I've got my fingertips right on your sacrum. Again. This is an adjustment I use all the time on old people. Old people, fragile people, kids, people who hate being adjusted. I can do these kind of moves. Pretty easy on me. And if it doesn't get it, I can always just put them on their side and do it for reals. Bounce, bounce, bounce. Bounce, bounce, bounce. Breathe out. So yeah, so that worked. So let's go back to where we started. I want you to TL that pulse point. It doesn't show. Now, we also found the alarm point therapy localized. Let's go back to the alarm point. Small intestine. And it doesn't show. So now, the crucial thing is, what really matters to the patient, push, push. Now that quad's working. And I didn't adjust the knee, I didn't touch the quads or anything. All I did was the breathing. So that's how, you could do nothing but this all day long and fix stuff. And the stuff you didn't fix, then you could argue. It's amazing how effective this can be. I'll go walk around a little bit. See if it.
How did you know which direction?
Because I didn't until I challenged.
Okay, so you were doing a challenge.
Yeah, first the eyes down to the right, sacrum on the right.
Right.
Then I went down and I just challenged P-Day, which is typically they kind of roll this way. At first I thought maybe it was like here, but just kind of just take off and really just challenge it. That's how I got there. So I didn't really know. I only knew what I knew as I tested and found. And then, so when I challenged, we checked it against in breath, out breath. She strengthened on it. In breath, so we went. If you go in the direction of challenge, on the phase of respiration that negated the challenge. That's the mantra. With spine, with cranial, almost all cranial. With teeth, you go in the direction of challenge. on the phase of respiration that negated the challenge. Now you get out in the extremities and it's not that way. So, first of all, did that quad fix? Push, 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 push. It's pretty good. Go back to the small blisters there. You go push, push. No, I'm happy with that. Okay, go back to the meridian. In the pulse point. Push will test the formerly weak muscle. No, so yeah. She needs, undoubtedly needs, let's do this. Eyes look down to the right. Eyes look down to the left. To the left. Up to the right. Straight ahead, close your right eye. No, you're good to go.
Yeah, thank you.
So what was I looking at what was one eye closed, one eye open? What am I looking at?
Serve. Line 2.
One. One eye closed, strong indicator muscle weakens, that's atlas. Usually on that side, unless they're switched. If I close my right eye and I go weak, check my atlas. Now, does that tell you how you adjust the atlas? You gotta go in and challenge, palpate, you gotta do the work to determine, sometimes it's a lateral, a lot of AKers, Dr. Francis always, he says, oh, that's a lateral atlas. Well, sometimes it's lateral, sometimes it's not a lateral atlas, sometimes it's an anterior, sometimes it's just fixated, but it's definitely an atlas. So what's eyes to the right? This won't be on your test. Ocular lock will not be on your test, but you'll want to use it in practice. Really valuable technique. Eyes to the right is what? C2. C2, eyes to the right or left, right or left. Eyes straight up is usually occiput. Eyes up and to the right is occiput on the right. Occiput on the left. Eyes down to the right is going to be sacrum on the right. Down to the left is going to be sacrum on the left. Eyes straight down is usually going to be bilateral sacrum. Eyes straight up is usually occiput inferior or bilateral sacral base fixation. Usually it's occiput. That is a money move. That is like, I don't even like teaching that the first session or two because it's like, you have to learn all the other stuff before you, but that is like an amazing shortcut. So let me try one more person with this protocol. Now, so we go pulse point. That's where you first go. You first strong indicator muscle. Then you go to the pulse points. Find out which one appears to be deficient. So start with a strong indicator muscle. Then you go pulse point. Go to an associated muscle to that pulse point. And then you go to the alarm point. Then tonification, which we get with small intestine 3. And then challenge and adjust based on the associated points on the bladder meridian. Yeah, I think I might have a slide with that. So I put on here, so when we workshop this here in a bit, we can, you'll have quick access to these. These are the points you're going to use. Now, don't worry about the low points. Don't worry about the hollow dots. Just this is mainly for the tonification points. And then you've got, this is another list of them for you. Find where I need to put, so these are the associated points. So that you go here to find what level of spine you want. Then we get into the meridians, but I put these, we're not gonna go through every meridian slide. Maybe we will if we have more time, but this is more for your, the meridians are organized very well. You've got the associated muscles. This is associated nutrition, so on and so forth. Multiplication, sedation, and low point. Spinal level that was beyond the associated. So this is a quick reference for you could use in clinic. Shows where the meridian actually is, arm point, so on and so forth. Of all these slides, a lot of these slides I'm not real happy with, but this group is really good. Somebody really put some good work in on these. And I'm sure you guys all have various reference materials, but this has, they won't have the associated muscles. So let me take one more person. And do another, go through the protocol. Anyone? Anyone? How are you feeling? Recent? All right, good. Yes, please. That's a start. Woody Allen said 80% of life is just showing up. No. That's not bad. I could probably use that. Let's try that. That's a little crisper. So 3 points. Now I don't know anything else. We haven't checked her for switching. We haven't looked at posture. We don't know anything about history. Nothing. We're just like going in here about. Now this muscle is associated with what meridian? What meridian is the piriformis, gluteus medius, gluteus maximus, adductors, and tib posterior, sartorius gracilis. What meridian is that? Are those all on? They're on the circulation sex meridian. And they're related to the adrenals on an organ, glandular muscular. Where this would be related to the pericardium, circulation sex meridian, but also the reproductive organs and that part of the endocrine. So that showed something. Go to the other side. Now let's go to just one at a time. Interesting. Huh. Came up with the distal left. I should probably have myself checked. Sometimes when I keep finding the same thing, it's because I have it. So in your case, it's the heart. It seems to be the heart meridian. So sit up and face that way for me. So we're learning this weekend. We're going to learn the subscapularis muscle, which is one of the 4 rotator cuff muscles, which is the main heart. It's really the only heart-related muscle in AK. So, and the way we test it, preview here. First, we check our range of motion. What the subscapularis does is it depresses the head of the humerus and internally rotates. More than anything, it stabilizes. Say, oh, it's the throwing muscle. Well, it's not. I mean, it gets injured with throwing. It's not the prime, shouldn't be the prime source of power for throwing. Hold that position for me. I'm going to brace you here. Have my hand. That test's pretty good. I like to check range of motion first before I go straight into testing just to see what's, because sometimes they'll have pain. They'll go, ooh, that hurts. So I'm not going to get too aggressive with it. You look at the difference there, see that? I don't know if you can see from the cheap seats, but see now, actually, now she's releasing because we've been fiddling with it. First went, you stopped about here. You notice that? Now it's starting to release. That's her, okay.
Yeah.
Now, we tested you from here. I'm gonna there again. See, in that position, it's weak. So it's pretty happy to hear when we ask it to go here, it's not. So this one here, that one's pretty good. So the alarm point for the heart meridian is right at the bottom, right at the side point. Your left hand side point. Bring this up a little bit. See, that turns right on. Take your hand away. So that's our culprit right there. So we went strong indicator muscle. We used the rectus. Positive pulse point. We went a little deeper. We determined it was most likely the deeper in heart meridian. Went to a heart-related muscle. After some fiddling, we found it was weak and strengthened to the heart alarm point. So, pulse point, muscle, alarm point. We've gotten that far. Next step is to I would probably treat heart 9, which is the tonification point, right there, and then challenge the spine. But let's go ahead and so we're looking at probably T6-ish. Let's start with the deltoid. So because I need to TL because I'm going to use a strong indicator muscle. I'm going to come down here to T6, and I'm just going to tap that vertebrae. Got lucky, we could go up. It should be T6. 5's okay. 7's okay. T6 is not. So that would make sense with the associated points that are associated with the heart meridian. Are you with me so far? So my treatment is now going to be what? Treat heart 9, which is the tonification point, and I'm going to challenge and adjust T6. Associated points. Now I might, if she was having, she was tired, or she'd been, or maybe she was older and has had a lot of heart issues, I might test her on. I'd start with B vitamin. Probably B1, 2. I'd look at see if that needed that. A lot of times B6, B3. What's the other one that we make? We make it from cholesterol, CoQ10. Might test her on CoQ10. I test her on renal-related stuff because the heart is one of the most sensitive, or one of the most regular recipients of adrenal hormones. Epinephrine. So let's have you lay on the back again. Is that okay for you? So I'm going to go to heart 9. Now I might look and see if they have some sort of, maybe they've injured this pinky, but hers looks just fine. I'm just going to go in here and I'm just going to stimulate it. Oh, let's use the laser correct with that. Is that clock right? It's like there's some, I'm like in some weird, it's like a dream. I come down here, like none of the clocks work. It's like, doesn't rain, it's sunny, clocks don't work. Like, this is Twilight Zone, yeah. I assume you guys are all here. You guys, why you don't have time for TV? There's an Apple TV. There's a series called Severance.
Oh,
You've seen it. I've watched the second season. It took a lot of focus to get through the first one. It's small. I mean, it's like they're, it unfolds. Okay, so T6, so we treated Harp9. So what time is it? We'll take a short break here just a bit. Let me finish this. So I think I'm probably going to want to adjust this supine because it's kind of flat right there. So I'm just going to challenge it this way. Challenge it this way. Yeah, so it's going to need to move this way and this way. So lay on your back. Okay, if we adjust that. We don't have a pillow or cushion around here, or a sweatshirt or something I could use. Yeah, just something.
Oh, we got a pillow right here.
Oh, pillow, yeah.
I have no idea.
Yeah, pillow. It's like. See, it's a dream. When I do this adjustment, if you haven't already taken the glasses off, do, because you might bring them up and kind of, my glasses can get kind of, that's not good. Now let me have all your weight, breathe in deep. Now it needs to move a loop to the side, vertebrae right here, and I'm just going to kind of do this. Okay. There we go. Okay. Now let's go back to the, oh yeah, we were doing this one. I'll go ahead and touch that point again. We were at the deep-ish. That holds. That and face down. Now bring it down. Yeah. There we go. Stretch, make sure it's, yeah, so that's it. So it worked the same as it did with the small intestine. Brilliant. Happen to hit this, find the same pulse point. Intestine, heart, same thing. Pulse point, muscle, water point, codification, challenge and adjust on the associated. Throw in nutrition there at whatever before you fix it. Now, I wouldn't test around nutrition now because of the muscles. You do emotions. That's good. Put your hand in. Nothing obviously. Thank you. So, does anybody have any questions? Because I want to.
Oh, please.
Oh, yes. What we- okay. So, anybody have any questions? We're going to workshop this in a little bit, and I want to make sure we really get this. This is going to be like category 2. This is like ocular lock. This is one of those really efficient ways to go in deep and quick and see where their main. Now you would tie this in with someone comes in, well, they got hip pain, got shoulder pain, they got headaches, whatever it might be, digestion. But you start with this and you just see, well, what are the meridians telling me? What does this system tell me, first off? Then you examine, of course, each owie area, you examine it specifically for problems. If there is, in fact, a mechanical issue in the hip, injury or pain versa or something. But you see, you're going in kind of a central, really kind of deep avenue to evaluate the patient right off the bat. That's kind of how I see it. So this is really crucial, and it's really crucial that we get this part. And next session we'll learn how to, if the weak muscle doesn't respond to the alarm point, then we go to the 24-hour clock and we'll session so that we add add another layer to it. And then the last one, the 5%er, is where pulse point is there, but the muscle isn't. You can't find a weak muscle. So you have to kind of go to the end of the Shannon-Cosile cycle to look where the weakness is hiding out. I guess, but that's what we call a 5. They don't show up very often. I don't see it very often in here. Usually this will get me where I go. Oh, so the pulse point will test positive, for example, long testing. But then none of your quads are weak. None of your abdominals are weak. Then I go back upstream, 24-hour clot. This would be to the heart. No, small. I go to the large intestine. I back up on the 24-hour. Then I would use the low point to bring. Then the third one is pulse points there, but then none of the muscles. Oh no, I'm sorry, I mixed that up. I would go to first go forward on the Shen cycle, look for a weakness. If that didn't find, I'd go back to the original, where the original element was, and I'd go backwards on that, on the code. One of those is gonna find your weakness. But that's the 5%. Don't worry about that now. Don't worry about it.
I have a question. When you're finding these, you're not like pushing on, like let's say you're up in the hand again, you're not pushing on it, you're just TLing it.
Exactly.
And then you're finding the muscle that's for the area that is in distress. Okay.
Yeah. Sometimes they correspond. Sometimes the area where the point is being disrupted is, especially in the feet and the hands, plenty of opportunity for the hands and the feet to get accumulate microtrauma. Most common, on average, the most common meridian that shows up is the liver. It seems like most people show up with the liver the most often, and then of course the fire element ones seem to show up a lot. Circulation, sex, triple one. But the heart does show up. Heart and small intestine does show up. I always get excited when I find a heart one because they don't. I had a years ago. Gosh, this is 20 years ago. I had this patient, a guy who was probably in his 60s, early 60s, and pretty strappy guy, and had neck, shoulder stiffness, and both of his subscapularis muscles were weak. I mean, weak. This guy was a stout dude, but those muscles were just weak. And I did what I could to get him. I didn't have much luck getting him to turn on like I'd like. I did some adjusting. He was hard to adjust, very stiff through the upper back and neck. And I asked him to come back in a few weeks, and he died of a heart attack. Somebody in his family called and canceled the appointment because he had a sudden heart attack and died. Here I saw it and I thought, oh my God, both heart-related muscles were weak as kittens. And he was on heart, was being treated by a cardiologist already. Sure, issues. But yeah, so that was interesting. So, should we take you guys want to take a few minute break and we'll workshop these? Maybe make sure you have one of your laptops handy with the. I also have my iPad here too. We can have the notification points brought up so you can quick reference.
Oh, I thought you were just like going to sleep there. I was like, oh no, I might curl up my back. It's been it's 3 minutes. I can't.
Quit kicking the crap out of John, dude. Seriously.
Well, you know what? Tell him to stop deserving it.
Oh, that's what my wife says too. Join a podcast.
Oh,
We're doing
I usually just leave it.
that's what I was too. She just.
Because I can't promise you something I'm gonna do.
Somebody cancels, she's got to go and stuff like that.
Okay, baby.
Shows up early. I all the years, I've never had an employee get and she's there as often as not.
Oh, he brought it to you?
Yeah, it was full this morning.
A lot of times she'll stay, I leave and she's still finishing up.
Yeah.
And that's Jennifer. Jennifer was out there. She checked my last patient out. She was out
Did you say yesterday?
there. Cocktail was called.
Yeah. She was late for a
Time
date.
time for her, yeah.
I don't think I get
Yeah.
that well. I didn't like.
Yeah, so it's like, it's great. And then like, there's always stuff
See, I don't get that
to
here.
go over. We're always,
So I'm down bad.
yeah, so I feel like my office is really there for a long time. It feels like, it just feels fresh and energetic. It's almost like you had an older car, I'm the older, and you decide to put a new engine in.
Yeah.
And you forgot how over the years that engine, your old engine had kind of gotten old. And I was like, shit, now I got this new engine. It's like, oh man. And it's like, so then,
I love that. That's a good analogy.
yeah. The practice has been refitted. But, you know, she's only 31.
Yeah.
She's got 3 kids. Her husband is, he's been a patient too, but he stays at home. Kids.
Yeah.
And, yeah, so I'm pretty tickled. I just gotta keep sure it doesn't become too much for her.
Sure.
And, you know, she needs full-time work.
Yeah.
So I now it's like, I feel like now I have a practice. I could actually bring somebody in.
Yeah.
How's the cord?
That's awesome.
What's that?
I could bring somebody in. I could sell my practice.
Yeah.
So
Everyone's like, oh, Q9 is gonna do it.
I had to get rid of
Yeah.
They moved some of the Q10 classes to Q9 because Q10 is so massive.
So
They switched.
They just
So it-
dropped
it's
2
kind of-
classes instead of having like
Seems like everything's
8
working out.
classes plus shifts.
it is. I'm still
like-
yeah.
I mean, it was easy. So, but
I had
yeah,
a
I'm organized.
massage therapist.
The last 2 days, I was like,
Oh, yeah.
I just gotta figure this
And
out.
that's been
So,
going
like,
pretty, she's been there
got
2 years
everything
this
set
month.
up, organized, got the schedule down.
But
So, yeah,
she's
it's good now.
she's
I haven't heard
very
anything too terrible
professional.
about
I have
Q9,
no
so.
problems with it.
No, but it's just
great.
it's
But-
busy work. Like they just want you to show up.
She
So
has,
it's like
she
there's
and
a
her
quiz,
husband have
but it's during lecture and
some hard
it's
things going on
questions.
out in
You know, stuff like
personal lives.
That's why I
She's
feel
at
like it's
that.
for
She's
a
at
lot
war
of
with
busy
the
work
local school
classes, which is
district.
a bunch of miscellaneous
Because they
assignments.
keep your kid
I
out of
also
school.
got
because
super
he was
lucky and had
a
both of
dipshit.
my lab
And,
posts. So,
you know, some parents like when your kid's a
Sometimes you just
dipshit.
go,
And they
You
get
guys
like,
paid.
I don't know, I don't know why they
Get
did
it
it.
done.
But other parents
Like,
are like,
I don't know
well,
why
no,
they did it.
Not my
it's not my kid.
Yeah.
You know, my kid couldn't
Like,
possibly
we're a
be
small
there.
class,
Right.
but like almost
So
every
you're
one of our
wrong.
quarters
Yeah.
You know,
got
and so I'm
both of
assuming
them. And we're just
she
like,
has
for real,
trouble.
like we don't have gym
Make
yet,
sure
and
it's
bar,
school,
and everything
school.
else is quarter, we just had to add that on.
She had, I found this out way
She
later.
got bulk
Yeah.
lab
She
posts.
actually, her prior,
There's
one
files
of
for
the
Gen Med and farm and
places where
Yeah.
she rented space, the landlord was supposed to do this and that.
It'll be okay,
And I-
it'll be
It'll
okay.
be
Annoying.
okay.
I honestly tried to knock out some of them already, because I'm like, if I just get all these out of the way before
Oh,
things get super crazy,
I'll just
get
get
it
Yeah,
done. That's
so
what I'm thinking.
I'm like.
They're so plain, they make me so angry.
Yeah.
I don't,
I
you
feel so
don't know these
purposeless.
things.
I do.
You know,
Well, that and like, we had
Yeah.
nutrition. and
I'm afraid to even
the
raise her
medicine,
rent.
it's just, like, all these
Am I next?
miscellaneous
I
assignments
know,
every
and she
week, and
thinks
I'm
she,
just like,
she tells me,
great,
she and Tiana
great.
have gotten to be.
no, I get
Yeah.
that. What year are
She,
you?
Alicia, she's
Quarter
like,
11.
She's like 22 now.
Yeah.
so
You're so close to
she
being
absolutely
done.
despised Jennifer. And they-
Don't tell me
Yeah.
that. I've got a
And
year
so
left.
didn't trust her at
So?
all for good reasons.
You don't feel like, no,
honestly,
the light at the end of
She
the
and Tiana, they
tunnel.
just chat away.
I
She
mean,
tells
yes,
Tiana
but
that
it's
she
like,
thinks I'm just
at the
great.
same time, it's like,
Oh.
Because I took her
trust
in,
me
gave her, you know,
with their
breakfast,
help,
and
like,
so, and we.
I'm responsible.
I always try to
Are you
make
gonna do
sure she's got what her
residency?
body
Probably.
needs.
Yeah, I wanna
If
do
there's
one
something
here
she
or
needs,
teaching one of some sort.
you know, anything to make her.
Yeah, we'll see.
And
We'll
And
see
I
if
would
they
sign,
accept me.
I'd
Yeah.
sign up for that.
And,
Dude.
hopefully.
I know, they want people so bad.
Yeah.
For residency.
And they
Hey.
Because someone wants to do one.
get served.
Yeah, no
They
kidding.
say
Holy
anything
smokes.
negative, I'll fat heads, dude.
But she is.
Because I'll sign up to be, I'd
Well,
let
that
you be my
She
resident.
is.
I don't know if there's a lot up here.
Her kid had,
Oh,
her
stop.
kid was.
I was just sitting there like,
Oh.
I
And
feel
he,
like everybody goes through that though when they
yeah.
graduate. Like
just
you
got-
learn all this stuff. And
Yeah.
Are you really ready
He's
to
getting
like
bored,
practice?
which
so you need to make sense of it all.
Yeah.
That's the
They
biggest
should.
problem.
Do you know what you want to do? Are you
Wait.
going to do
Yes.
physical medicine or?
I
Well,
really like
he
phys
started
med and like
making
gen med
friends.
stuff. I love ag.
Kid.
Botanical medicine,
And
I
of
do
course,
like homeo.
schools now, they take those threats.
I'll do it for acute stuff, but it
I was
really
gonna say you have to like
And he was
commit.
posting.
Yeah, that's the problem with it. If you want to be good at it, like.
Things that were
You're
scary.
really
And,
gotta
and that's what these kids do.
The intake for me.
Of course, yeah.
There's usually a
Have you
history.
done one yet? Or, like-
No, they like told
Yeah.
us about it.
So,
and I
of
was
course,
like,
that
sounds
got
like
school
something I
all
don't want to
It's
do.
really intense. Did you have to do one? Homeo intake? Like 40 times
cops
last
got
quarter?
involved. It was just.
Oh, wow.
No, you didn't have to?
Oh my gosh.
I
Oh,
never
she's-
got it.
She's
Sue had.
I thought she
Serious,
made everyone do it.
I scribed as a
So,
second, but
how are
I
you?
didn't.
What's up? Are you working at?
And so,
Yes,
Maybe
I
that was
was
my-
in
that
my
was my
first
last-
round of patients this
No.
week, actually.
I was like, I need new patients.
This
Sign you up.
Yeah,
Every new patient.
And,
gets
one patient or?
my
Last
first
week,
day
like, 2
is
new
fully
patients.
booked,
She
I
goes,
have
okay.
6 patients.
Just be ready. I was like, got it, I'm on it.
How many people you
And
know?
all referrals from other docs.
Dr. Dusty was like,
Yeah,
dude,
well, except for one new patient.
Hey, I
Yeah,
genuinely
things are-
tried.
What
things are
do
moving
they
I
in.
got?
swear, I'm not scared of people.
I have all
So I
pain,
can do a mock
which
case
I would
yesterday,
not.
or Thursday.
I figured with all the stuff I said, I was like, he probably finished it, but. just
Shoulder,
send it
hip,
anyways.
No,
Is it the Dr.
Yeah.
Dusty that did the guides?
oh, yeah,
Uh,
yes,
like
he works here. He,
I didn't know that.
he will,
knee pain.
he is like the
Those are
ultimate.
his? Sorry, that just clicked.
All pain.
Right up your alley?
Are you
Right,
kidding?
my-
Every single.
No, that's not, that's the Dr. Dusty.
See, I thought he was like a
Dusty.
mythological creature that.
He is mythological. I still don't believe he exists, but no, no, that's him.
Snack? I'm okay.
No, that's him. And he,
We were at Trader Joe's.
he keeps
Oh,
track
yeah.
of your clinic stuff
These are snacks.
really, really,
Oh.
really, really well. Much better than I'll ever keep track of my clinic stuff. I'll guarantee you that.
Ooh, side question.
Yeah.
Yeah, do you think I'll get in trouble for not updating my CPR on time?
He'll get on your butt about it.
He'll bug you every week.
Normally she's.
He hasn't
But if
yet,
you-
and it's behind, but
If you contact him about it, be like, hey, like, process of it.
yeah.
I'm not trying to.
Yeah, it's a good
I
snack.
think he's pretty.
You know where to go, right?
Well, you got your
Somebody
coffee
told me
bean
they
and
went,
chocolate.
there was one like right down the road.
Yeah, there's a
Bucks, but you have to get the book,
You couldn't need
and
it.
you have to read the book.
Yeah.
There's a guy on Pilgrim University. Go there for
So,
the
What's the
tell him
name?
you're in med school.
Who is he?
CPR plus or something.
I have to update mine.
I'll
It's expired.
I'll find it.
Okay,
Send it
send
to you.
it to
But
me.
you go in there and you're like, yeah, I'm in med school. And he's like, all right. Kayla was like 4 or 5 of us do it at the same time. And he's like, okay, do some compressions.
Yeah.
Crack, 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 crack.
Oh yeah, you had told me because
Done.
I went to one. He was really intense about it. He was like, you guys have to be here for 4 hours.
This cat, I'd be surprised. Okay, he was very chill. He'd been doing it for like 20 years. Super, super chill cat. He didn't care.
Well, you should send it to me, because I definitely have to get mine updated.
But it's 4 hours. You go in there in the morning, and the 4 hours is done in 3, almost 3.
I like it. In and
Oh,
out.
he's
So,
he's
so
perfect.
you're.
Yeah.
He's great.
How are you?
I'm an independent.
Oh, you know, the
Independent.
depths of hell.
What is
Wait,
it?
So they
I-
furnish.
What?
What does it do?
It was due by the end of last quarter.
They give me all my supplies.
You might wanna.
I know, I know.
From there.
You can get it done because just like he doesn't really have anything to hold over your head right now. But when he gets
I'm into where
like
I'm
that, like he'll.
Well, I know it's
Um,
important for clinic, and it's just irritating me because I know how to do it. I've literally recertified like 3 times now. I did it with my
Actually got my
wilderness
really
first
sweet
responder
feeling.
certification, so I'm like, they were really detailed
whereby
about it, and
he
I'm just like,
supplies everything for me.
I had, like,
I have my
PSL,
supplements, I did a cut of visits
team,
that
They
And
have like
like
the
the
regular
regular
like blood therapy and whatever. And kind of
CPR
for
certs on
get
this, like,
those.
Yeah.
I still get
Like
them
extra,
on
extra.
my-
yeah, I was like,
There's,
I know they expired, it has been 2 years.
there's
And
a vitamin causing me to get.
Yeah, I get it.
I
And I get
just,
50%.
I'm annoyed.
And then the other
I
half
can, I
is
definitely get it.
50/50 and basic
For clinic,
medical,
I
think.
completely understand having it on
And
these,
then
but
whatever,
right now,
at that
when do you
practice,
use it? If someone
it's
falls
after
out in the
practice,
middle of
so
class,
more there for, like,
But
the
like,
mental-
it's right. I mean, I'd help with
Well,
that
yeah,
too,
yeah,
but like, I feel like,
Here's an AK doc, he does a lot of PFT.
we're having him come and talk on Monday.
Almost corrected, but, yeah, he does it. He's actually coming to speak,
Talk
right?
on Monday.
At lunch. I don't think he ever could support.
I thought he said he's certified.
Oh, is he? Maybe
Or
he's
at least on
the
the
website.
Sometimes they're certified in offshoot.
Yeah. He's good though.
They're PAK certified, that means they took.
He does a lot of like emotional work. His approach is really great guy. 60/40 is good, yeah.
Especially if you're, I mean, I have one chiropractor, she has patients who were 65/30. And it was a good fit.
Yeah.
After about 6-8 months, she wasn't happy. So she wanted to go full on.
65/35 range works.
Well, that's cool.
I've never ever.
Well, in chiropractic, I'm not providing this.
So it's, yeah. Yeah.
And, but then, that wasn't enough. She, so then, okay, fine, so you can be a sole proprietor, and then we'll just do like the same way Steve and I did. Then suddenly she wanted to make every single tissues we ordered and handling and shit like that. I was like, that was.
Yeah, it's a lot of.
Yeah.
So that was the beginning of it. And no matter what happened, she felt like she was getting
No, maybe.
and but she wouldn't schedule more than 2.5 months.
Yeah.
She wouldn't schedule. She scheduled a full hour.
I'd be doing something else.
She didn't need it. She didn't know that much.
Right,
It's like you don't need an hour.
Yeah.
Do everything you have to
What are you
do.
gonna talk about for an hour?
And it was, but she'd been in massage for 10 years. And so, anyway, so the reason she wasn't making enough money is she wasn't, and plus she wanted to work later in the morning, leave earlier.
Oh.
And it's like, yeah. Yeah, she was good at the end. She was a good adjuster. Just lazy, yeah, just lazy shit. And, but longer she was there, the lazier she was.
We'll get comfortable and then that's the beginning of that.
Well, she finally left and she has her own practice now. And, she can practice however she wants.
Right. Yeah.
But I get some of her patients. I've had a few that were her patients that she left, some of which is Steve's patients. And a lot of those.
Yeah.
But Steve basically gave her some.
Probably. You can ever get it out? Yeah, thank you.
Yeah, that was, so that's why I've been really kind of shy about bringing something in.
Yeah, of course.
Now,
He grabbed you.
which I should have gotten rid of Jamie and
Yeah.
that would have been smart.
You get a lot of like bees trying to like fly into my head.
Well, good. I'm glad that
And I was
I'm
making
glad
a
that
joke
you're
with my
practicing
husband,
the
they
big
think
things.
my head like when I just swore.
I mean, it's so true. I was.
I'm
I got to
We
where
went to
I,
Fantastic Cabin, and everyone's like, duck. And when
got to where I was.
I was like,
checking up on Jennifer.
Yeah.
That was really tired of that. It made her really easy to fire.
I mean, are you serious?
She gave me.
Yeah.
And
I know, I saw your name on that page, I was like,
she was so
yeah,
surprised.
I
I
know.
was shocked. She called me, demanded her job back.
Yeah. Yeah. That's so cool.
Sweetheart's done.
Yeah.
And after a year,
I don't know, do you wanna do them like in practice?
she can't go unless she shows up.
Yeah.
Once you like, just like, bring practice.
But anyway,
My only thing is,
morning
I
I
have
sent
to like
the
pull
email,
up the stretch and then my whole
termination.
piece, cause I'm like,
I spent all morning, right?
I'm terrified. The first half, I've never done like consultation, and my first patient, I couldn't even.
And,
You had to
sent it out.
and
Then I
no one else had done that.
texted her.
She was like, yeah.
Oh my God.
And then it wasn't an hour later, and I'm just sitting at the house, trying to,
Yeah.
you know,
It was great.
and knock on the door. Doorbell rings, and I'm off.
Oh, yeah.
Because it would have been, she would easily had time.
Yeah, of course.
I go out to where I can see who's at the door. He's out on a motorcycle, so I want you to see if I can.
Oh, that's so
Really
cute.
playing. And he's a great big guy. And I literally, if it was her, I wasn't going to answer.
Yeah, yeah.
And so he came in and he's going to
Yeah.
I really need to go for a ride. I wondered when you were going to get rid of her. So we went off and had some.
Oh, that's awesome.
I'm going to use the restroom.
Yeah.
Babe.
Also, I'm just gonna ask you a question.
Oh, in that case.
Because that's literally it. I think congrats are in order because I passed.
That was really sad.
You said sessions.
Oh, I thought you meant like the jail, so I'm like sweating like a reuse area. No, I know, but
Hey, Aaron.
I need to memorize like all the details, you know, like muscles and like organs. Like I know some of them.
I'm working on it.
Well, I've been doing tedious work because unfortunately the tedious work helps me remember things. My brain just works like that. Well, obviously. What's he gonna do? Does he just keep doing it?
No, I'm gonna be so for real.
I'm
Someone
not
else can have it.
judgmental. I'm just worried. Yeah.
Doing all your
Me too. I'm like,
explosions.
I love it too.
Yeah, that would've been a great period if I didn't.
Okay, so.
I don't know.
Is he done? What do you mean done?
He's gonna try again. You don't listen to me. You think you're comfortable.
Where's the disconnect? Like, does he know where the disconnect is to where it's like not like.
And anatomy.
What's the blow up guy? I know. I don't even know what they're selling, but they're gonna get my. Or the guy that just got out of prison. That head was standing there with by the thing jumping around with the air car with the sign. Grand opening and they're jumping like this and,
No, I'm kidding.
some of them was like,
You should do that.
Yeah, I'm having the fun time of like my song. Perfect person. And I'm like, he wouldn't too close, too close.
yeah, we do that someday.
Yeah, the master's.
Use what? Oh, shit. Okay, so we did that. Oh, no.
I could have walked.
Have you done it?
Like a puppy?
My ears open.
Oh, no wonder you're so wise. That's why you're so wise.
Now I'm thinking Jonathan might need that.
His whole family came over. Took it out and like pulled it down, pushing it. I'm trying to get him to open it. And they don't want to. They're like, just do it. And so they didn't back. Maybe it's
Okay, guys, let's, I want to start. So, well, I want to do one more quick demo of the pulse point thing. And then if you, some of you have this on your computers, if you could bring up the associated point slide and have it with quick reference. And then the ones with the tonification and the tonification points. And the one with the alarm points. So there's really 3 slides that we, because I didn't, it'd be nice if I had a slide that had all of them on one slide, but in the future, maybe. So this is the slide, the alarm points. And then 1, 2 down is the associated points. And then way down is the notification. So I need to move those around for workshopping purposes. Anyway, do we have those handy?
What's the difference between alarm and, what was the other point?
Pulse points?
No.
There's the alarm points, the diagnostic points, and then the notification points. Notification points are the treatment. Oh, you're done.
No, never mind.
Yeah, association points.
Associated points are the points, so the bladder meridian is kind of like the main framework of the matrix, energetic matrix, if you will. And along the bladder meridian, there's points that connect to all the other meridians.
Oh, so it's the back shoe.
The back shoot points, yes,
Okay.
yes, the back shoot points. And you got the front shoot points too, right? Move front, move. See, I told you, you guys know more than I do about this stuff. But, so somebody come up here and I can do a quick, and we'll do it seated. Anyway. And we don't know anything about her history, we don't know. And what muscle can we use when with a patient sitting? One I like to use, once again, we can use the piriformis. Or you could use a quad, or you could use, there's a seated rectus that you can use. Let's try this one. So, put your fingers on those points. To the other side. There needs to be about a finger's width between each. You know, no pulse points. Okay. Now, If there's no pulse points, here's the possibility. Patient could be dehydrated. Sometimes if you're going over a sleeve, which you're not. Sometimes there could be a cranial or upper cervical and or TMJ. A lot of times that's the case. So what I would do then is go back. If I find that, I go back to my strong indicator muscle and pushing. Breathe out all the way. Breathe in. Hold the breath. So she doesn't weaken to either breath. Go back to the pulse points. And breathe in. Breathe out. Hold. Doesn't show that. Okay, relax your jaw. Flat jaw. Flat jaw. So just let it hang there. Okay, now go back and do this.
We're not helping, are we?
There we go.
Yeah.
There we go. Okay. Flat jaw. Flat jaw. Hold. Yeah. Okay. So we have your jaw is interfering. I would have to fix your TMJ. Yeah. I mean, or reset it to where we, yeah. So, which we'll do, but let's try somebody. Thank you. Someone else who doesn't have TMJ itis, okay. That's something you run into a lot. Usually, a lot of times,
Stress.
it's cranial.
Right.
Where there's relax your jaw. There we go. Look at that. Okay. So right off the bat, now we've got one of these of 6 is going to be the one. Let's start with distal. Oh, we're doing this one. Oh, we're done. We're doing this one. Okay, go ahead. So that's the middle one. Proximal. Okay, go back to the middle one. Go very light. And go a little deeper. Okay, so what's the deep middle pulse point on the left? What element? Liver. So that's so if we lay, we might have to, because I always like to work from this side. So we'll just flip it. Okay, so we'll just go ahead. So go back to middle pulse point. Yeah, see. So it will weaken everything. It's a global weakness when it's positive. Now, liver, what's a liver-related muscle? There's a couple. Rhomboid. Oh, what's another one that's a little easier for me to test in this position? Pec major sternal. Pec major sternal is liver. Pec major clavicular is stomach. Rhomboid is liver. So we'll do PMS. So PMS, how do I test it? I test it like this. Test it like this. So we aim it towards the opposite head. That's going to get our pec major sternal. So hold. That one's strong. And that one's not. So 2 fingers, and that's a liver 14. Doesn't have a number on it. There it is. Now it happens to be about where the liver Chapman is. Only the liver Chapman's only on the right, remember? Where's the stomach chapter, right or left? It's on the left. Stomach, spleen, pancreas, Chapman reflexes are all just on the left. Liver, gallbladder, just on the right. So take that away. So it strengthens to its own alarm point. That's good. She's an 85%. So what do I do next? Pulse point, muscle, alarm point. Go to that. So what the next stage is, we can go to the associated points and the tonification. The tonification for the liver meridian is liver 8. And it's right about where the medial meniscus is. Kind of near where the sartorius is, not attaches, but it passes right through there. So it's the left side, so I'm going to go to her left liver 8, and it might be tender. So I'm going to hold that point, have you bring this up here, and you push to me again. And see, that works the same way the alarm point did. Everybody catch that? Look at that. I mean, that's strong. That's really, if I take my finger away, not strong. I could go just a little ways up, not strong. Little ways down, right on the point, and you know you got it. I mean, that is it right there. That's liver it. That's where I'm going to treat her. Now, if I was going to use needles, I'd stick a needle in there. Like maybe you're like your guy. And go have tea. Acupuncturists do. Other patients are circulated. But I'm going to, since I'm on, I'm going to go ahead and treat it. I'm not treating with laser because I set it down somewhere. So I'm just using my finger. And I'm going to hold that, because I've done this for so darn long, I hold it until I can feel the energy shift. I'm not asking you to do that, but if you do a few thousand of these, you start to realize it'll start to pulsate just like a Bennett point will. And then you know, you've woken up that meridian. So the liver associated points are going to be T910. Somebody bring up that on your screen, the associated points. Where am I? There we go. And that's where my pointer is. So, where were we? Here we go. Okay, so liver is T910, right? Now, I can go in and just reach up about 12. I kind of work my way up. Should be right about there. So I'm right on T9 and 10. I'm going to go back to, I'm going to use a strong indicator muscle. So I'm going to use your PM. And then I'm going to go to that. There it is. You go a little higher, down, a little lower. I'm getting a positive gal. So very straightforward. So which way do I adjust it? I don't know. I'm going to lay face down for me. Oh, you can come down here. Do we have face paper? Here it comes. Safety first. So, I mean, you guys can start mobilizing because you're going to all do this, but if you want to come up and have you had any puppies in this area recently?
I always feel like my spine, my ribs are slightly like out of place right here.
Kind of like jammed up.
Yeah.
So, strong indicator muscle. Good. And I'm just going to go to, see, there's the 12th rib. We always say, you know, scapula, tip of the scapula, that's going to be about T7. So right about there. And Okay, so I'm gonna go left or right to left, left or right. That gives me a positive challenge. Breathe in. So she negates from a breath in. So I could do it respiratorily this way on an in-breath. Okay. Or we could do it more aggressively, but let's try it. Let's try it. You've probably been adjusted, right?
Technically, I've never been to chiropractic. The only adjustments I've ever actually gotten are like at the school.
Oh, okay. Good, and breathe in. Good. Now, what I'm doing with this finger, I'm pressing the vertebrae, and with the other hand, I'm just kind of trying to roll that body around that. When you're adjusting this way or any other way, part of your thinking, you need to be seeing what those facets are doing. When I do this pressure, I need to kind of visualize what's that vertebrae doing. It's kind of doing this. I'm trying to create rotation, but also release where the facets are kind of hanging in it. There we go. So let's see if it challenges. And my challenge as a doctor, with the examiner challenging it, now I can just lightly touch it. If it's really out, it's going to show. That's not always reliable. So if I'm doing Dr. TL, I might go in there and just kind of, instead of just touching it or just TLing it, I might go in there and just kind of shake it up, just to bring it up on the screen. And that seems to be fine. Now lay on your back, please. And we had, actually, if you can go back. Sorry, I can turn this page. So we had the PMC on the left, PMS on the left was good. Now, we treated the liver 8, and we treated T9. So let's see, this is strong. And that's good. Now we'll go back to the pulse point. And right in the middle, ish, and that doesn't show. Now this, now we got that layer of it. Let's see if there's sometimes another meridian will want to there. So I'll go back through the process again. See, this doesn't take very long. Quick. Yeah. So right now. Thank you. So that was a good example of how it works when it's 85%. You guys want to do it? Now, don't do anything else. Just do this. Just do this. If you can't get any pulse points, call me over.
Yeah. When do you want to So, the triangle. Oh, sorry. Oh. Okay. I'll fill it. Well, now we have more. Okay. Let's see. That's true. Okay. We'll give it some time and then we'll see. Yeah, try to be like tomorrow or later and see what happens. Yeah. T3 to T4. Yeah. I'm not going to try it. Yeah. Well, I'm still TAing. I know this much about Twitter. I know that much about what about my Oh, are you blanketing? Can you just like scoot forward a little bit? Mine or just trying to make sure I don't. Oh, I didn't know if you were cold. No, I'm trying not to be. Okay. Oh. Can I use your performance?
Find out if you want to.
I guess it doesn't matter. 10. Okay. Can you do your whatever's on the line? Yeah, just do like this number thing. You do the other side. Okay. Unclench your jaw. Do that. Just like. Okay. I'm sorry. Hold on. It's fine. No one's judging you. Oh my gosh. Okay, do that. Try the other side again. Yeah, I know. Do you want to try to look at that first? I mean, it could be like tester. So she can try. Oh. We tried one down. Because it could be that. No, no. Because you did say that like just lay down and try it. You're so close. You can lay on your back for now too. You're so close. I can taste it. You can't taste it, but I can. What are we tasting? The fact that Dean's almost a doctor. Exactly. Yeah. I don't like to think about it personally. Dr. Dean. Can I use your record? You're gonna be my doctor. Yeah. Before we go. So hurry up. Oh, Dean, you can be my doctor too. That'd be so fun.
They'd be like, "Are you getting anything done? Because all I'm hearing is laughter."
Yeah, he just make fun of me. Cool. Okay. Can you?
I don't know. They're really bad. I feel like I can't put my shorts on in the morning.
You can try the other one.
Oh, sorry.
It's okay. Oh, there we go. Okay. Can you do one at a time now?
Yes.
Is this okay for you? Are you okay? You
I'll
sure?
be fine. Yes.
Are you like okay though? She said I'll be fine.
I'm fine. Like, you got that. I've had some.
Okay, cool. Okay, go down. Oh, there we go. Okay, middle, left. No, let me think. Wood. Oh.
It's so emotional.
No, I said oh. Okay, so we do the pulse point and then we do the muscle. Okay, muscle. We could do. We could just literally copy him. It's PMS. It's PMS. Okay. Yep. Yep. That's so weird. How am I? Maybe I don't need to be on the same side of testing.
He did it, but he did like a weird like push thing.
I know, that's why, because we need to go this way, right? Yeah. That's why I was like, that's weird. Because you need to be going that way. Can I do like this? Is that illegal?
Yeah, I don't. You always manage to find out all the things that I haven't thought about.
Is it illegal?
I don't think so.
Well, I'm just thinking
Well,
about
we're
like,
also high up on the table.
maybe that's why it's kind of awkward. Okay. Okay, push towards this way. Okay,
Oh,
so.
okay. Wait, did that?
But I need to. Oh, your alarm point. What's the alarm point? I forget.
Liver 14.
Liver 14. Is it on the left or the right?
It can be a both.
Okay. So try your right one, and then that way I can do like this.
Wait, left one?
Yeah. So then I can test here. Yeah. Okay. So we did pulse one, we did the muscle, we did the alarm point, and then. Yeah.
T9?
It's so the tonification point is liver 8. Yeah, and then the spinal level is T9, T10. Okay. No, I was thinking.
Oh, for the love of all things.
I know, that's why I was like, huh. I won't.
Everything
I
hurts
know,
on my
that's
body.
I will let it happen. That's what the face is for.
I would never sue.
I would never sue.
Never. Hi.
Yeah.
Oh yeah, no, that's
Right there?
No.
Is it? Something, is it right there?
Yeah, that's there.
Can I push it?
Mhm.
Do you want me to put a needle in?
Oh god, no. Every needle hurts so badly. I'm getting an
I'll just do. So
They're giving me
if
an
we're not
A in
as
English.
talented as Dr. Domi, do we wait to see if it's like less tender when we like push it? Is that what we're doing?
Yeah. Maybe you can steal his laser.
If you look at one, oh, okay. Well,
It might be right on Versa too, I feel like.
Really? Would I be able to? I would be able to feel that though, wouldn't I?
I don't know. 'Cause that's like
So. Oh, too many questions entered my brain. That's okay. So when you find the transportation point, if you're not talented, like just stop. You don't feel the effort. Sure. Can you?
I love that.
Do you wait for it to get less tender? I do. Okay, that's what I was hoping to do. She was like jumping off the table. So I wanted to make sure that was legal first.
It's legal. I usually start really like gentle
And whatever point you found also.
But could be an Ashi point too.
I have so many. I'm getting an ANA, a homocysteine,
yeah.
an MMA test, all of that done.
Get it checked out, girl.
When you said MMA for a moment, I was like,
She's like,
you're starting. Okay.
Button it.
Anyways, I know.
anyways, yes, try that.
Yes. Okay.
I'm pretty sure I've already been tested.
Do you use lasers?
I don't, but I am getting a little bit more adventurous in terms of my gadgets. Like, you're still not gadgets.
I love any kind of gadgets, like kitchen gadgets.
Oh, I love a kitchen gadget.
Any kind of gadgets.
I'm
I'm like, let's do it.
But now I'm like,
Is that getting less?
I would like to say so, but no.
Oh,
I'm still like discussing
just
the
hang out with it. It's
That's why I was like, I think you're on the first
any
one.
different.
She's like, it's worse.
Try this one.
This one? Okay, I didn't know how it was.
I was like, I think you were on a person, but both hurt like.
Try that. Anyways, I'm getting more adventurous with gadgets because Dr. Pride and Mesa has like all like the archer stims and the fiber cutters and whatever. And I'm like, maybe I don't have to poke people and like make them.
I know, that's why I was like, laser, vibration.
Yeah, and it's less work when I'm like all the line.
Exactly. I'm like, I'm tired. I mean, but yeah.
How we doing?
Is that better, worse? It's getting the same.
I think it's getting better.
Okay.
I had all of them when I just described them.
Okay.
We're just gonna say that.
Oh yeah. So do we? Okay, and then we go to the spinal level. Yeah. Okay. Would you be able to? You can swing with your back forward.
We're all a little angry.
That summer's coming.
Oh no. Okay. Like that's the bottom floor. Yeah. I don't even know. What's your hypertension? So I get the
You don't even know my comments.
So I know. Come on, man. It's like I'm like that so late, but then I'm like, I don't know if it's spot right. I just feel like can you keep it up so I can like? Okay, so now. Okay, so. Oh, okay. Okay, so that means it's. That means it's posterior. Okay. So can I have your arm back? Okay, so I'm just gonna do. Okay, take your ankles. Next. Okay. So we're just going to okay. Just gonna start. That's how we're doing it. So you do it and it's posterior. Do I still do like dynamic to correct? Do you know what I mean? Because I did dynamic to find it.
Yeah.
So do you like you breathe in and then I do this number?
I mean, I think you can do it. I know that's
Okay, well, let's just. Oh, okay. So let's just do that. Okay, so take the breath. I think that's right.
Yeah, I'm literally from it. I pushed it straight forward statically, and then I did a really good.
Okay, let's see.
So now you can do those before you correct.
We'll say that's right. Something happened. So now I need to check my breath in. Can you lay back down, actually? Because that's how we found it. So I'll just go back to that. So when we go back and check, we just check for the pulse point to see if it's like better.
I think so.
Oh, I could check your muscle as well. Because it was your right one. Yeah. Push towards my hand or your hips. Nice. Okay, now can you, do we recheck the alarm point also? I feel like you can do all of it. You probably could just check all of them. Okay. Yeah, and then just push towards your left hip. Okay, so you use your leg, and then you can touch your middle point there. Nice. We did it. I have a fundamental question because I get mixed up every time. Respiratory adjustment. Yes. So I did T9, T10, and I did like the dynamic situation. Yes. So let me just post here. We still reach that way. Yeah. The way that okay.
Cool. So you did a dynamic challenge. You had her breathe in, go strong, then you correct on the breath.
Okay. I was making sure I had it correct.
Yeah. Yep.
Okay. Cool.
Stellar.
We fixed it. Lovely. No, I was just because when I think about like challenges and when you think about respiratory, it's a little backwards, right? Because it's like if you were to do, because usually like static, you're like you find it and it's weak, but you like do the opposite of it. Or it's like one of the. Yes. Yeah. Yeah. So it's like if you think about like respiratory adjustment, when you find it that way, my brain wants to be like, oh, do it the opposite way. That's not what you do it. Do it the way you found it on the breath. Do you see how I was like kind of confused? So anyways, I was just clarifying to make sure that how many questions? What is this? Stomach? It's one of those. Probably 41. 40 something. I can't remember. I have to relearn the points all the time. I think that's what it is. Because it's like no one uses that. Whatever it is, no one uses it. You're like, wait, that's not going. I did it better. I mean, I don't know if you can do it rest just without the. Yeah. I mean, because if he has like sacral respiratory, I feel like you can probably do anything like that. Do you want to try to see if another one of my meridians shows up? Okay.
Like every time
I just like, it's like so high. Here, I can bring my thing back up. I was telling Dean I've been doing annoying tedious work where I've been like going through the PowerPoints and like, that's the only way I can try. I can't. Anyways, so they're all right here. Well, you have boards too. I don't have these. I just have OSCE, which is like, I don't know how stressed I need to be. Yeah, that's what I trust too. English. That's what I had to worry about. Do you know Regine Harris? Yeah.
she was like, it's so easy, don't worry. And I was like, yeah, it really, yeah. She's in your before. I just, yeah, I think I'm gonna print out, this is what I did for CE. I'm gonna print out the report and just be like, looking at like, what does it say? What does it say? Yeah. Yeah, I've had a lot of students tell me that. So I was like, so like when I've been like reviewing stuff, I've been looking at that. Okay. I might have had my jaw clenched. Let's start again. All right. I did. It was pretty aggressive too. After it was definitely clenched. Okay, try again. And what was I get to? Relax. Good. What are you doing? Okay. That side. Sure. There we go. I had my mouth open. Okay. This. Next one. This.
Okay, so.
Sleep. Yeah. What is that? That is so funny. What is it? You're like, that was really, yeah. Hi.
Alright,
We got the toe.
let's do search. Oh, wait. Ready?
Sometimes I would be surprised.
That was strong. Yeah.
No, I was just wondering.
My feet might be sweaty.
Give me an
Yeah, they are. Both my ankles need to be adjusted, but every time someone goes
oh, yeah. That's
your socks and stuff. T7 is.
no, it's fine. Okay, so say for example, say for example we have a jam. I can just statically challenge that. Okay. Hard. There you go.
Nice. You do.
Now these are pretty tough because people walk on them.
I'm here
on behalf of Grace Howard. So right now, so that I would assume that this one needs to just come down this way, right? But I can challenge it. I can challenge it this way. And just like that, I can challenge it this way. It's okay with that. I can challenge it this way.
So if she lets her arms rest.
So it wants to go. This is to go in. This is a yellow paper. So I would go like that. It would be like my hand right on my palate. Bring it down. Now, okay.
Yeah.
Another,
You didn't hear anything, but it did something. I could feel
I
it.
should have. Another way I could have done is I could have wrapped this in a more traditional way and then kind of roll apart. And I'll do that a lot of times too. If I slide down a lot of times to get the first. Honestly, I think I just promise. The first example, I find the first example where you have
Yeah. Wait, should I? You good? Wait. If you want to.
if it's stuck,
I don't often
it's not stuck, I don't mess with it. If it's stuck, I'll mess with it.
Also, your traction might be because when you push, like this way, that's traction, if that makes sense. How would you
I just move. I just move. But another way to do towels, I know we're off the weeds here, but another way to do towels, see that?
you like lost?
Now you come in here like this, just gently relax. That little, there we go. Pretty much, just gently.
Nice.
And you can also do respiratory this way, like if they strengthen our breath in, breathe in. I do a lot of respiratory.
That looks good. Okay. She's really hard to move.
So that's totally not showing. These are often.
What do you hear about it?
Get jammed with shoes that are this is your shoe.
Yeah.
Good shoe. You always want to look at the shoe. Shoe for her. You wouldn't believe some of these shoes, you put them up and they're not even
I bought mine a little bit bigger on purpose.
yeah. So anyway, that's how that's your towels. But just think about what it does. It rots in there, and it's the main receiver all around, and it comes up and sends force up. If it's stuck, it can't do that. So whichever direction it's stuck,
that's not better.
People overthink the towels. They overthink a lot of stuff.
So I was trying to figure out if people at school
If they don't clean off those, don't keep.
That took all of my low body.
So when a lot of times, they're not
But
adjusted. They
if
might not
this
be
doesn't
adjusted.
feel great, try it in my hand. I
It's
use
not how high I go.
There's no way.
When you're up
I also have
I would use muscle testing. It's way more accurate than landmarks. This for that stuff. Always take it.
Okay, I've done a few of them.
Because it's but it's still absolutely true for each patient. There's times where people have like a lateral mass that's on one side. And I'll tell them they feel like their atlas is lateral, but it's not. They just got a fat lateral mass compared to the other side. And then if I use muscle testing, this is when I find out what the actual fixation is. It might not be there at all. It might be something.
No one feel like he did it with my kids. I don't remember what
I can teach you.
I'm sorry. No,
I have a lot of details that
okay, that looks pretty good.
like it. If I don't like an adjustment on my knee, I'm not going to do it. And that's why I don't like those I don't like drop tape. I don't have drop tape. I don't bring it here. And
What was it like? I was a little bit.
go through my whole career and never freaking book. I know there's a place for sometimes
Yeah, try me.
like that tower adjustment.
You can try A to B and if you want to.
Set your drop up a little bit.
Yeah, so it's like, let's say like right down the middle of this line. I go on either side of this line and I'm here.
I just don't like drop tape.
To make it more straight.
Yeah.
And then,
It's like ultrasound. I did that for years. Finally, I realized shit. Like, and then I see and wasting my time in the patient's chair. It's like, yeah, ultrasound, stem, muscles, all that. Let them go to PTs. They can get all that. Insurance companies. But don't waste my time. Lasers, and whatever. These guys spend 20
okay, I'm just gonna get
so they couldn't adjust it.
Yeah.
Talus or an atlas.
Yeah, but I literally
They're great for you.
yes, the time. Yeah. Were you yelling here?
There's something in there that I'm getting there's something.
I want to say that
I'm getting
That's yeah. We gotta move back around here. Doggy dog. Yeah.
You want to know the you want to know the I will roll with it.
Very nice work. Podcasts are so good.
There might be some questions.
It's in my
There'll be questions about point.
I already know how to draw mine.
Oh no, you lost some. The body was coming first of all. How are you gonna?
The body was
getting a question.
I'm like, how strong?
The body got.
I can try to do. Okay. Let's see what we can do.
It's just so simple.
The way that I have to get everything is very okay. I still have to slide off though. Okay.
You wanna test it?
Okay. Yeah. I get it. What are you looking at? Yeah, we can do. We can do like. Yeah.
Wait,
Okay. And I can show you what did you push up? Is that what did you like bless you? Yeah. What do you get? Okay, so it's like a little. So nice. Okay. And then what did you do? Did you do like down that way? Yeah. What else did we do?
He did this way, he did that way.
Oh, just like down like this. Okay. Okay. So we need to pull it down, or is it?
That was so good.
No, that means I didn't like it. I thought.
No. So is it like it's
No, that
not
was
jammed,
good.
it's
That was really
it's
good.
compacted.
He first started by testing it to see if it was jammed, and it was. And then he looked for what strengthened it
Okay.
by using different vendors. So I think
Okay. So
it needs to go up. But that doesn't make sense. Why would it need to go up? Like how?
because I was on my tiptoes and I was on my tiptoes and I think it slipped.
Okay. So if it doesn't, I'm just gonna try to like rationalize. So I think
That's great.
I wonder if your point contact changing.
they're gonna have to. Okay.
I'm confused now. No, I'm not.
So I did this before and it didn't like it. Right. I was ready to go forward. A little bit more effort. Like your whole body. Like so that your mind almost are sleeping. Yep, there you go. Yeah. So you're gonna lean forward now until you're right above my. How do I get? Do you feel that? And then you would drop to see if it's like. Yes. But you need to. You can lay on. You really can. I'm getting nervous. I know, like kind of like the setup was beautiful. You just need to use the leg. So that means it needs to go back. Now I want you to like. So you see what I used to do earlier? If I did this, that means forward and it needs to go back. So I wonder if we know. Okay. Yeah. Okay. That's what you take a deep breath. Are you laying? You're the one. Wait. Oh, just breathe out.
I think I'm breathing normal.
Okay. Okay. So now take a deep breath in. Are you okay?
Yeah.
I agree. Okay. So we're gonna try. I don't know how much.
I don't know what I called that. Was not your right.
Okay. Take a deep breath in. Wait. Yeah. Okay, go ahead.
What coins are these? They're Tinder.
That one was like, wow, it feels better. I didn't get it. I lost track.
Kidney 2UB60.
I know. I was thinking UV also.
Yeah. And then you roll.
I don't know if it's gonna feel good. Okay, do one more. Sorry. Okay. Take it down. Breathe normal, and then hold. Yeah. It worked, but I don't know if it's gonna feel better.
I think all my acupuncture. I'm so
You need. Is there a vein for when you say like?
I think you lost your kind of.
I know that's what I feel like that was the thing.
Oh no! And you don't hear me.
Yeah, it's
I'm gonna turn like or that one shot.
maybe that one. Look, I actually talked about this, but I don't know if it's
No, I can't get it. It feels good. Oh, it feels good when you're doing it.
You're like you're telling me.
Are they in the way? Your tummy is different. Like,
Did you finish mine? Did you want to keep going through it, or you think you got it?
I want my
You got distracted. Just make the stomach split.
so that you're good. Otherwise, you have
Oh yeah.
yeah. Okay.
What? Middle trap is this one. Upper trap is this. Yeah.
Okay.
With this huge.
Yeah, I think that feel a little bit better. Yeah, it's so good. It's like it's out of you.
Or is it the like this? I can't remember.
Oh yeah.
Yeah, you might have. You seem like you're remembering better than me.
I also had it.
Oh, then you
So I know
know.
it's something like this.
Okay, then whatever you want. You just tell me where to put my arm, and I'll put it there.
Wait, no.
Yeah, that's so good. It's so good. That's your adjustment. It's just it's my rib. It's not you. That's your adjustment. Probably. That one's been in there for a long time. Because if it doesn't work, it's I know, it's totally fine. I'm like, but yeah, that one, you're fine. Popcorn, at least one rib. I love that. Yeah, very good. That's a good adjustment. Very good. Yeah, you killed it. That was. The pleasure is mine. No, you're fine. I don't.
No, you're right. I mean, you remember that. And it could be one of the sure. No, but I know you're talking about. Yes, I think so.
Absolutely. You're back from the. Maybe I will.
So, I gotta check in. And everybody?
Okay.
Everybody. Anybody and everybody. So we've got one here that she's percolating on a needle. Has everybody else been tested and tested? Has everybody found a meridian that's deficient?
I didn't have any. Everything else.
You guys have?
Not judging.
So anyway, everybody got this. Any questions? There's got to be questions. Hey, everybody, are there any questions about the steps of the protocol? Pulse points, muscle, farm point, notification, association. That's the five steps. When you do that, I usually do it last. I usually do the truncation first, kind of bring the energy up and then go to the associated spinal level. And sometimes they don't have a subluxation, they don't have a fixation, but you always check it. And if they do, you correct it. I usually do that last. Now, if I'm going to check nutrition, I'll check nutrition before I do the tonification or the adjustment. Because once you do those, then you kind of lose your. So, a couple of you didn't have points. You didn't, but you do. You found them? Yeah. Good. Okay. And then you didn't. So, but everybody else did, had something. Now, one person had we had small intestine, and then when you guys were testing, she found something else. Circulation, yeah. So that can happen. You find something, and then you let somebody. Ideal setting, let them go off and do their life for a few hours and come back and recheck them. And either that meridian will come back, or there'll be something, another weak link. So, let's guys finish up, and then we'll take a short break, and then we'll come back to this, but kind of go on to something else.
So I know you probably haven't done too much.
Oh, that's what I said. Okay.
How come I don't remember?
Something like what? Salad, wait, what? Yeah. I don't remember why he called it that though.
I love how you guys actually have a plasma. You guys have one.
I don't remember plasma.
I was left out. He does that, like, amazing. Because I know when I'm singing, I was like, I still use your PowerPoint. He's like, oh, I think I underneath it. Stop. I know, I didn't say anything.
No, I knew it was the one. He said it out loud, and I was like, oh, I don't remember. I think it's just because it doesn't follow the.
Oh. And I think it's one of those weird things.
Like it's just a really.
He does, where like, what is it,
All right, let's go.
like,
Why do I get that thing?
I want to.
exactly. You really don't get it. It's like you
It's just the day after Valentine's Day. It's something we're doing. Yeah, Valentine's Day is love in the heart. It's very hard. Okay, he says,
I know she's striking for in every way. She says.
I don't know, something about but I think it has
opposite, probably opposite.
Something about that, yeah.
See, I might remember it because there's something. I might have taken what he said and something incorrect, but follows my brain. But I understand that he had something.
You guys are stronger than I am. I have no idea.
See, that's it.
Not one time they're close.
yeah, I will not.
Because I know the rest of you.
Anyway.
We go so distracted.
We started thinking about
The alarm went
they're not like that. Like are they acupuncture buddies?
Yeah.
Not all.
Okay. Okay, I think that's why we got distracted because I was like, oh, we were looking at the alarm. And I was like, oh, that whatever. But we're back.
We're back. Am I off my rocker or are the alarms going to hear the actual organs? Are those the ones?
Oh, I did. Pancreas tickles your spleen.
No, she's just
That's
She's I can always tell you.
Oh, you know what? I think that
Are they?
they're where's your
Right in your stomach, maybe stomach.
these look like front move points. Like I think front moves are
Maybe alarm point. You might be.
This is another short rock.
Chris just talked about the HF the other day. Where's my one document?
they look like
So there's
No,
so
you're probably
that's
right.
that's a fight.
yeah. Don't ask me nothing.
I always think I like
So that's yes.
It's really good. That's a hit.
Oh, it's yours?
Yeah, you're the third person.
You're wearing this on the 6th.
No, but I was like,
On the 6th, it's the right way.
yeah, it's roots. They want you to buy like a little bag of this small.
They have a bag of
Yeah. Yes, they do.
I'm out of commission.
What time are we breaking for lunch?
Okay.
Every month.
Yeah, it's very good.
I like it too. That? My spleen and stomach is sad. Help.
SOS.
Just get the way you are. Do you want middle or do you want middle or upper? Well, it's easier. Middle and upper. Hold on, I have it here. Hold please. Everyone. Lexi. That's really
Next.
hard.
Yeah.
Where'd you go? Oh wait, right here. Oh wait, it's middle and lower. Just kidding, you were right. So middle and lower. Oh, yeah. Don't you have to- I like that. I want to put my arm up. Your arm. What are you doing? Lower graph. Yeah. What's this is where we got distracted. Next liver.
This side, we still got this side.
But we have to do the alarm point.
I thought it was for a week.
I don't know if it has to be the process.
Okay, well, they're all strong. Great, good job. Love that for you.
Yes, ma'am. So you're looking at the muscle, and then you see the upside down. Usually it's lower. And if you don't have, like if it's not your lower top, for example, you need another muscle to do that. Like it tests you, you know. Is it illegal?
Often the weeks we're trying to get that.
Is it illegal if like the muscle is strong? No, it's not illegal. Yeah. No, it's not illegal. I'm all for the shortcut. Is it actually? I mean, how much is that? Yeah. Okay. So we're going to try.
You want to do your 11.
I would here. I didn't feel it. That is kind of weird. Let's try that.
Is this?
Nope.